Good afternoon. I think that most of you probably have heard most of the things that I will explain today. But anyway, it's a good idea to have an overview of such a complex thing, the immunology of PRRS viruses. In today's talk, I will talk firstly about the cycle of the infection in the farm, and this is because understanding the epidemiology of the infection is the key for control. Then we will go for the immune response, and as we have been said previously, about how to immunize the gilts, how to immunize the sows, what to expect from vaccination. And certainly for PRRS, the things that we can expect from vaccination are a little bit different from the things that we can expect in other infections. I will talk a little bit about the interference or the potential interference and the role of maternally derived antibodies. And finally, I will talk to you about a general idea of the control of PRRS in the farm. So, the cycle of the infection in the farm. Taking as an example a farrow to finish farm, just for having all the phases of the production, of the swine production here, most often what we see in the farm is that the virus is introduced into the breeding herd. And we notice that because the farm suffers an abortion storm. This is the worst case that we can suffer in the farm, and is a clear indication that the virus, or at least that a new isolate of the virus, is entering the farm. Soon after this initial outbreak, most of the sows on the farm will become infected. And soon thereafter, what we will notice is that there is a huge increase on the proportion of pyremic piglets. Firstly, in the maternities, and that's pretty obvious because the few sows that reach the maternity and deliver alive piglets will deliver this type of animals, with piglets with very little survival in this phase, and these animals will carry the virus to the nurseries. And at this point, what we will have is the spread of the virus in the nursery, and then to the fattening units, and finally, about 100% of the pigs in the farm will be infected. The point here is that this infection is not a chronic in a strict sense, but is a kind of a long-term infection of the pigs, and that means that the infected animals will harbor the virus for weeks or even for months. And in the farms that they are using internal replacements, this is pretty important because the animals that are infected during the fattening period will harbor the virus to the gilt stock, and from the gilt stock, they will reintroduce the virus into the breeding stock. So the cycle starts here, continues in the nurseries, go to the fattening units, go to the gilt units, and is reintroduced. And if you look at this cycle here, you can notice that we have some pink arrows depicted here. And these pink arrows are a little bit trying to show what are the ways by which the virus is spread within the farm. Obviously, we have this cycle that is harbored by the animals, but we also can carry the virus from the nurseries to the breeding stock in a backwards sense. And this is because in many farms, in many farrow to finish farms, or in many farms that are farrow to weaning, maybe the internal biosecurity is not good enough. And we can harbor the virus from the nurseries to the breeding stock in the boots, in the clothes, in the hands, or even in the hair. And also you can have lateral introductions like this. We can introduce new isolates of the virus from external sources. That means by introducing animals that are already infected and that have not been quarantined enough or properly because of the contamination of the trucks, because the visitors in the farm, or many other sources. So in practical terms, that means that in an endemic area, for example, here in Catalonia or in Spain or in most countries of Europe, the potential sources for infection are multiple. And if you look here, you will rapidly understand that, this transmission, vertical transmission that we have here from the sow to the piglet is the key for the control. If we are able to stop this vertical transmission, we will be able to stop the infection in the farm. But this is not so easy because of this long-term infection of the animals. And in this slide, I tried to show you the maximum contagious period that has been described for PRRS virus. For animals that are infected in very late infection, very close to the farrowing date, the maximum period of infection that has been reported is about 210 days with PRRS2. And that means, in practical terms, the whole productive life of an animal going to the fattening period. For winners, the maximum period of infection is about 150 days. And if we talk about PRRS1, in our hands, most of the animals are viremic for 3 to 4 weeks, some of them maybe 5 or 6, but you can still find the animals infected in the tonsils or in the lymph nodes for an additional period of 2 or 3 weeks. And that means that they are able to harbor the virus for a long time from one phase to the other. Similarly, for sows suffer a very short viremia, 7 to 14 days, but you can find the virus in the tonsils up to 3 months, and this is really important to understand how long the quarantine should be for the new replacements. Given that the animals can harbor the virus for at least 3 months, an unknown origin, that means that you don't know if they are really infected or not, you have to keep them isolated for at least 3 months. And you know this is not very easy in most of the farms. And also males. Kim talked before about the role of males, of boars, in the transmission of PCV2. Here, boars are really important because shedding of the virus in the semen is quite long, about 50 to 70 days. And the problem here is that this shedding is not constant because it's associated to the presence of macrophages in the bulboretal glands and in the tissue associated to the reproductive tissue. And that means that you see cycles of shedding. In practical terms, that means that testing of semen by PCR is not that good for this purpose of controlling males. So what happens in the farm after the outbreak? We know that during this period of the outbreak, most of the animals will get infection very rapidly, but what will happen afterwards? And these are results of 3 different farms here in Spain. The first one, the red one, was a 1,200 sows operation working weekly batches. The second one was a small farm operating in bi-weekly batches. And the third one was a farm that was thought to be stable. And I think that this one is important to understand the problem that we're facing. During the outbreak, and this is a measure of the proportion of viremic piglets that you have by testing umbilical cords at birth. During the outbreak, you find in most farms between 1/3 and 1/2 of the animals born viremic. And we are in the hot period of the abortion storm. We are here. 15 days later, some farms still are very high, but some others still to go down in the proportion of viremic animals, but we still have about 10 to 15% of the piglets being born viremic. 30 days after, some farms still have around 8-9% of the births being of viremic animals. And the important thing here, in farms with no apparent clinical signs, farms that were thought to be normal, and if you want, later on we can discuss what means normality under this scenario, about 6% of the birds can have viremic piglets. So that means that at least for PRRS1, we can have very serious outbreaks, but we can also have this type of unstable farms with no apparent clinical signs that maybe could be revealed by a more an in-depth analysis of the records of the farm. Okay, and what is the importance of that? And the importance of that is related to the way that we are operating our farms. We are operating based mainly on productivity, and that's quite reasonable. This is a business. We have to make profit, but that leads to increased replacement rates. And the higher the replacement rate, and for most of our farms here in Spain, we are about 50%, that means that at any time, between 1/5 and 1/4 of your cells are gills, are P0. And that means that if these gills are enter from external sources, they have been to acclimate before. This is really important. If we enter animals without any immunity in the farm, and the farm is infected, the result will be catastrophe, will be authentic disaster. What is the expected evolution of an infected farm? And this is a very early paper depicting what happened in the Netherlands during the 90s. Look, this is the, I would dare to say, this is the paradigmatic picture of an endemic farm. You have a first episode of the infection, a new virus enters the operation, you have a clinical outbreak with lots of abortions every day, but soon thereafter, the clinical expression of the disease seems to stabilize. From time to time, then, you have these new peaks of abortions. And the question here is, we are suffering this because there is a reemergence. In other words, I have the same virus spreading again in my farm, or is this a new strain entering my farm? And this is really important to understand. We have to understand deeply that if we are suffering a reemergence, that is, the same virus that was controlled is now spreading again, something is failing in the internal biosecurity in the farm, and something is failing in the immunization of the farm. But if we have a new strain in the farm, something is failing in my external biosecurity, and we will see what happened with the heterologous immunity. Okay, so very simply, external biosecurity is focused to block the lateral introduction of the virus. Immunization is aimed to decrease the susceptibility to the infection, and internal biosecurity is aimed to block or to decrease the within-farm transmission. These will be the three concepts that we will be used today. Okay, first, big idea to take home. If you do not plan an immunization protocol, you will be feeding the infection cycle. If you are letting non-immune animals, naive animals, entering your infected farm, it's like throwing gasoline to the fire. It's exactly the same. So we have to start this program of immunization by immunizing the gills. Okay. What happens when an animal is infected? Why the natural infection is not enough to provide full immunity? Let's see a little bit this classical picture made many years ago by Dr. Fernando Soria at the University of Nebraska. And when the animal is infected by PRRS, first we can see an early infection phase that is characterized by a viremia. And this viremia will last more or less 3-4 weeks in the piglet, 1-2 weeks in the adult animal, and then the presence of the virus will steadily decline. But wait, in spite that the virus is not found anymore in the blood, we can still find the virus in the lymph tissue. And as you saw before, this can happen for months. Okay. The immune response. The animal that is infected by the virus rapidly develops antibodies. If you use the ELISA that we are most using for the diagnosis of PRRS, about 50% of the animals are seropositive at day 7 post-infection. And 100% of the animals, or almost 100% of the animals, are positive by day 14. The thing is that these antibodies that we are measuring and that appear so fast are completely unable to stop the infection. just because they are devoid of neutralizing capacities. So these antibodies here, in terms of protection, are nothing, are worth nothing. The antibodies that can protect the animal, that is the neutralizing antibodies, appear about 4 to 5 weeks after the onset of the infection. And funny enough, sometimes these antibodies correlate with the cease of the viremia, but other times these antibodies can coexist with the viremia. Or even sometimes these antibodies do not appear. So, and you can see that this is very difficult to, to cope with, because this is not what we expect from a normal, to say it so, viral infection. Okay, what about the cell-mediated immunity? If we look at the animals that are infected, for PRRS1, we are able to detect cell-mediated immunity responses based on the production of interferon gamma secreting cells about 2 weeks after the onset of the viremia. That's fine. The problem is that when we do a follow-up of this cell-mediated immune response, the strength of this response is going up and down, up and down, up and down for several weeks. And we are pretty sure that this first phase is not correlated with protection. Indeed, the cell-mediated immunity starts to increase seriously when the infection disappears. And we are pretty sure that this increase here is correlated with the final clearance of the virus in the body. So as you can see here, this is quite complex, because we have kind of a persistent infection that is not that persistent, because finally the animal is able to clear the infection, that has neutralizing antibodies, but these neutralizing antibodies can appear when the virus disappears or can coexist with the virus, and that's really difficult to understand, okay? Important things, whatever. If we transfer these neutralizing antibodies to another animal, and we will see that later, we can confer a level of protection. So that means that these antibodies that maybe are unable to clear the infection in the naive animal, maybe are able to protect from the infection. We'll see it later. Okay. I told you that a different problem is what happens with the heterologous infection, and I would like to show you this paper is more than 15-year-old, but basic things still apply that show what happens with the heterologous immunity. This paper made by Dr. Mengeling and co-workers many years ago showed that when, for example, you have a group of pigs that are vaccinated with one strain, and certainly they were infected with this strain because the animals were viremic by strain number 8, and they were challenged with strains 8, 9, and 14. Most of the animals were protected in this case against 8, except this one, and against 9 that was a different isolate. But look, if you do the same with the strain 9, that is, you infect the animals with 9 and then you challenge the animals with 8, 9, and 14, they are protected against 9. Homologous protection is good, but maybe they can be protected against 8, or maybe not, and they can be protected against 14, or maybe not. And if you do the same with 14, here, you are protected in most cases against 9, but not against 8, and maybe not against 9. So what that means, that really means that we do not understand what is the basis for heterologous protection. We are unable to forecast what degree of heterologous protection exists between two given isolates. And this is pretty important. So the next message is we can have homologous protection, almost full. We have a level of heterologous protection that can range from almost full to almost nothing. And this is, again, very difficult to understand without a clear correlate for making a forecast. Why this is like that? This is what is called a heat map. It looks really complicated, and it is, but it's very simple to understand. what we do in a heat map, and this is a work done by the group of Tinta Prieto in Madrid, what we do in a heat map is just to do cross-neutralization experiments with hyperimmune sera against different viral isolates. In other words, all the sera obtained against all the isolates are crossed with all the isolates, okay? So we can check the cross-reactivity of all these different isolates. And look, you can see here that for some cases, for example here, the hyperimmune sera against this isolate is able to neutralize a lot of the isolates. And again, these isolates here are not related phylogenetically with these isolates here. But for some other strains, for example, this one here, you see almost no neutralization. Everything is blank. Not even with the very related isolates of the same phylogenetic group. So, in other words, the basis for the cross-neutralization are in a very fine molecular basis. And that means that by using sequencing at present, we are unable to forecast anything of these. And it's exactly the same when we look at the cell-mediated immunity. Two isolates, A and B, call it A and B. In the first experiment, animals were infected first with A and then were challenged with B. In the second, they were infected with B and then were challenged with A. And look, gray homologous, blank, white heterologous, homologous heterologous. In the first experiment, homologous cell-mediated immunity was better than heterologous cell-mediated immunity. In the second one, heterologous cell-mediated immunity was better than homologous cell-mediated immunity. And that means that the order of the things is important. It's not the same being infected first by A and then by B than first by B and then by A. Okay, so cross-reactivity cannot be forecast. After all this, can we do something? Yes, of course. Yes, we can. And the first thing that we have to do is to produce an acclimation of the gills. Because, again, if we enter naive gills to the farm, we are throwing gasoline to the fire. We have to keep this idea in mind. All the control programs start by the acclimation, of gills. What we can do for acclimating the gills? The first thing that we can do is to expose deliberately the gills to the virus. And this can be done in several ways. We can make the animals contact with infected material. We can even inject the animal with the serum of infected animals or many other things. The main idea for this, don't do it. Why? Because if you do that, you have no quality control check. You don't know what you're doing. You are transmitting the virus, or maybe not, and maybe you are transmitting other pathogens that you don't want to transmit. So very rapidly, since you do not control the process, so since you cannot forecast the heterologous immunity, if you are doing that, in simple terms, you are just spreading the infection out of control. Don't do that. Or maybe you can try to be more conservative. Previously, we have been told that we veterinarians are very conservative. Yes, we are. And I'm sorry to say, but it's true. And maybe we want to do that by contacting the animals, for example, the gills with old sows or something like that. When we tested that, the success of this type of procedure is not more than 50%. So that's not a good idea. Or maybe we can use vaccination. And the pro of vaccination is that we control the immunization schedule. We know when we are doing the immunization. We know with what we are doing the immunization. We know how many doses we are using for the immunization. We control the process. This is safe. And in case of something happen, we can call to the company and say, hey, I have a problem. And obviously, since we cannot forecast heterologous immunity, this is as good for this side of the problem as any other thing that we can do. So we have to start by vaccinating, and the idea is to get the highest possible immunity before the first gestation. Before the animal enters first gestation, the gill should be immunized. Okay. How can I do that? Before starting, what is the status of the guild? Is that a seropositive animal? Is that a negative animal? Obviously, if we start with negative animals, I mean virus-free animals, antibody-free animals, and we start with young animals, we can fully control the process of acclimation. First idea, whatever your decision, start with an MLB, with a live-modified vaccine. We need to provide the strongest way to induce immunity, and the strongest way is a live-modified vaccine at this point. You have to decide if revaccination is needed. From time to time, for example, here in Spain, we are using animals that have been infected at younger ages. So this can be considered a priming. If the animal is reaching the farm negative, is free from the virus, but was infected at a younger age, maybe it's not necessary a booster, or maybe it is, if the period time before the immunization is very, very long. At least, take-home message, at least priming and boosting are needed. Priming and boosting are needed. First immunization and second immunization, and we can decide, we can talk about how to reach this goal. Okay, so that means that we need no less than 6 to 8 weeks to achieve this protocol. And this gives you a clue about how long the quarantine acclimation should long. And decide what is your boosting strategy. How will you perform the boost? Okay, I have my guilds. They have been through all this process. They are immune, or at least as immune as it's possible with this type of protocols. And the question is, and what for sows? Do I need a revaccination? The answer most often would be yes, twice or 3 times per year. And this is, Kim before told that with PCV2. This is still a matter of debate, the duration of the immunity in birds. What protocol? 60 was pretty common in the last years. I personally do not like this very much because I think it's not intended for a disease like birds, but anyway, we can discuss that. Or blanket vaccination. Are we vaccinating the animals, all the animals the same day? And with what we will do this booster? With MLB and KB, a combination of a kill vaccine, alternatively with a live vaccine, only kill vaccine, we can do different things. Very basic ideas. Blanket protocols produce more homogeneous population. Combination of blanket plus prefarrowing could increase transfer of maternal antibodies, but wait again. Remember what I told you before about the neutralizing antibodies. Okay, we are not 100% sure of the effect against heterologous isolates if one heterologous isolate enters the farm. And one important thing, how can I monitor? With the current ELISAs that we have in the market, some multi-vaccinated, multiply vaccinated cells may test negative, and we really don't know why. So this is important, okay? Decide your scheme for monitoring the farm. Just some data about this combination of protocols. This is a paper that we published some years ago comparing MLB plus MLB or MLB plus inactivated vaccines, just to simulate what could happen using the inactivated vaccine as a booster. And what you can see here is that by using this protocol, after challenge, the results for the infection of the different groups, that is MLB, MLB plus MLB, MLB plus inactivated vaccine or nothing, were quite similar. All the protocols produce more or less the same level of immunity, in the practical immunity in the animals, and obviously the unvaccinated animals were all infected. So, summary. Acclimation of gills, live vaccine, or if the animals have been naturally infected before, that's okay for priming the animal. And the question, the critical questions here is if the animals are first free before the vaccination, the age that we are using, for how long we can have a quarantine, and obviously, are we testing the animals? Because this is critical. We have to obtain proof that the acclimation has been done properly. Recall vaccination with live or inactivated. Again, what is the infectious pressure in your farm? Is your farm stable? Is it unstable? What is your case? What is your external risk? What is the protocol that you decide to use? And finally, the vaccination of piglets. Is it worth to vaccinate piglets? Okay, is your farm unstable? If your piglets are viremic at birth, forget it. You cannot do miracles with a vaccination. How intense is the infectious pressure in your farm? What is the flow management in your farm? How are you controlling the flow of pigs in your farm? What is your type of farm? And be careful. The more the maternally derived antibodies that you have, the more the interference with the vaccination of piglets. And in practical terms, what all this means, what we can have by vaccinating animals. We can have protection against clinical signs in sows. Unvaccinated gills that were challenged at day 90 of gestation, just take a look here at the numbers, okay? The stillborn piglets, 43%, 76.7% lactation losses, compared to only 14 or 20% lactation losses in vaccinated animals in a heterologous challenge model. So you have clinical protection, you reduce mortality and reproductive problems, and you reduce viremia as well. Another experiment by the people here at the Universitat Complutense de Madrid, and gills that were vaccinated, this group and this group, naive gills, challenged at day 90 of gestation, very little infection. Still you have animals that are infected, but compared to the unvaccinated animals, the viremia is much more area under the curve. That is the parameter that is used for evaluating that. And going to the piglets, the role of maternally derived antibodies. I told you previously, I will speed up. I told you previously that these antibodies, when they are transferred, they can have a protection. This is a classical experiment done at the University of Nebraska, in which antibodies were transferred by injection to the animals, neutralizing antibodies. Just for having an idea, if you reach 1 to 8 of neutralizing antibodies here, the viremia do not develop in most of the animals. So that means that at least in the homologous model, if you reach a certain titer of neutralizing antibodies, you can have protection. But these antibodies should be present beforehand, not during the course of infection. The problem is that when you have very high levels of maternal antibodies, and these are different groups of animals that were vaccinated, nothing, antibodies, infected, antibody negative, infected, antibody positive, virus positive, antibody positive, virus negative. When these different group of animals were tested in the farm, in presence of high levels of maternal antibodies, all animals behave the same and get the infection by the 8 weeks of age. In other words, if you have very high titers of maternal antibodies, you can block the vaccination of piglets at young ages. Nothing new. I mean, that's basic immunology. And what is the usefulness of this vaccination of piglets? Just to show you an experiment that we did with a live vaccine in which we kept animals, vaccinated animals, in the pens And we introduced one animal that have been deliberately infected. Okay, we challenged one animal and we introduced this animal in the pens with vaccinated animals, or we introduced the same infected animals in naive pens. Okay, the result: vaccinated animals were able to withstand the infection for at least 21 days. In other words, if the basic reproduction rate was 2.78 in unvaccinated animals, that is, one unvaccinated animal was able to transmit the infection in this period of 21 days to almost to 3 animals, the same value for vaccinated animals was 0.5, and that can be considered that we are stopping the infection. Given said that, the animals were obviously kept for 35 days until the challenge moment, just to have no influence of external virus. Finally, how can we control the infection in the farm? And as Kim told you before, this has to be thought such in a way as if we were thinking of a complex thing that needs to be seen from different angles, okay? So we have 4 different angles for the control of birds. Diagnosis and monitoring, where we are, what is the status of the farm. Immunity, we saw it. Acclimation, maintenance of immunity, sows and piglets. Biosecurity, if the virus is continuously entering your farm, you can do whatever you like, that you will fail. Keep that in mind. And management. How can you manage your farm to reduce within farm transmission? This will help you a lot. So, very simple take-home messages. The cycle of birds in the farm is maintained by sows and gills. If we are able to stop the vertical transmission from sows to the piglets, we will be able to stop the infection in the farm. Homologous immunity is very good, almost full, but is only partial in heterologous models. And at present, we have to consider that all infections are heterologous in comparison to the strains that we have in the vaccine. So we have to live with this. 3, this strength of the heterologous immunity cannot be forecast. We move in an uncertain sea. We have to live with that again. But if you don't use an immunization for your gills, you will face catastrophe. Be sure of that. 5, we need recall vaccination. So we have to plan ahead the way in which we will do this prime boosting and recall strategy. 6, if we vaccinate, we reduce the likelihood of transmission. How much? This is a matter of discussion. And 7, by vaccinating only, we are not able to stop the disease. But without vaccination, it's much more difficult. Thank you very much.